off the record for a reason. And then it's not just this group, it's the other group too. I'll have the same little intro to them. Calm down, Lou. Sorry. All right, calm down. All right. Yeah, and most likely you didn't get a chance to listen to what I recorded when I wasn't able to be here on Friday. So effectively, I did a little intro to all of these things. And I would listen to it because I used the other PowerPoint, the one that comes from the textbook that was there, that whatever chapter that is, chapter 9, chapter 10, whatever that I think was 9, that one, chemical methods of control. This is the one from the Nestor textbook, and I use the names here, particularly when you get to that chart that I showed you at the end. That's, this guy over here, this stuff. So I'm planning to go through this and complete it today. That's today's aspect. And so, I mean, this is just reiterating what I had talked about before. There's a whole lot of different things, whether you're using these at home or you're using these in a clinical setting. It varies. So, a lot. I mean, if they're disinfectants, they're going to have toxicity, and particularly, they many times will have environmental toxicity. I mean, there's a lot. I mean, a lot of cleaning agents that we used to use back in the day. I mean, it was horrible if you had to use them at home. You had to open the windows. People with respiratory problems certainly couldn't use them. We didn't have a lot of other alternatives. There's a tremendous amount of toxicity. There is very limited. The ones that are active in the presence of organic material have unfortunately become very difficult for us. Okay. I'm thinking of something now. Hold on one second. And I hope they still have this chart in this one. Let me take a quick look, because names are misleading. And they used to have a wonderful chart, and I haven't even checked to see if it's in this updated PowerPoint I'm getting here. And I should have led with this, more or less, that type of stuff. Yeah, this is the kind of stuff I went over the last time. This. Don't let the names fool you. Okay. Oh, I use Lysol wipes. I use Clorox wipes. They don't have Lysol, and they don't have Clorox. Okay, because they wouldn't let you walk into Giant Eagle, and the first thing, I gotta wipe. It just drives me nuts. They're wiping the shopping carts down and everything like that. Those are called quaternary ammonium salts. They're the things they now have in antibacterial soap because they don't have a funny smell or taste. Because you wipe that down, now it's on your hands, maybe you're wiping your hands, and where are you going in Giant Eagle? Where are you going in Walmart? Most of the time, you're going right into the produce section. You're going to start picking up fruit, vegetables. You're not going to want that on your hands. Believe me, they know what they're doing. So, is it helpful? Yeah. Is it Lysol, Clorox? Let's be clear about it. Halogen agents or Clorox, these are very strong. You would never use them. They also have a funny smell. Okay. Notice disinfecting spray, quaternary ammonium salts with alcohol. They're going to evaporate quickly. Contact lens stuff, you're going to talk about biguanide in a second. Soap, mouthwash, basically alcohol. Purell, alcohol, maybe a little detergent base. The eye drops here, when they're using a chloride solution, they're going to be extraordinarily low concentration. Eye drops and contact lens solutions, you have to be very, very careful about that. And they've learned that, but you have to have something strong because what grows in there tends to be fungi. Okay, and those fungi, if it's not prepared properly, can be extraordinarily difficult. Anecdote, real life anecdote. The number one producer of it was a variant on their Boston solution. If you have that, and it comes from Bausch and Lomb. So if you're wearing contacts, you're probably using a Bausch and Lomb chloride system. And most of the time, that's their contact lenses. They make those as well. They're the largest maker and the largest maker of that. They had never had a problem until maybe 15 years ago, when their plant in North Carolina ended up with a fungus in their manufacturing, and 5 people lost their eyes, at least a eye. I mean, you can imagine they've never had that problem before. That's how problematic things can be, and that's why you're going to see agents that are a tad stronger, but scientifically so, because a mistake in that area can be extraordinarily detrimental. I'm all about I know all about the inside of it. My sister was an exam vice president of Bausch and Lomb before she retired. Had nothing to do with that. Okay, but she had basically she was more of a marketing person and was on the committee and they had to get out in front of it because they knew there was going to be significant liability. I mean, it cost the company, it cost people in the company probably millions to billions of dollars when things like that happen. And the worst part for people who lost their eyes, obviously, I hate to put in terms of money. So understand this is very significant stuff. You don't want to make mistakes in these kinds of things. So maybe that's a good frame to use it. And don't let the names fool you with anything. Read the labels. Oh, we have Lysol wipes. Everything's fine. Yes. Okay. Don't start. It's easy. Marketing fools people. Okay. So organic material. That's why you probably have to use things that are a little stronger in that. Compatibility. Is there a residue? Sometimes residues are desirable. Cost plays a role. Storage plays a role. Environmental risk plays a role. A lot of these agents are very, very light sensitive, just like bleach is. So you always have to have them in an opaque container that are there. Alcohol. Same 2 reasons. It doesn't do a whole lot. And the best thing about it is right here. It evaporates quickly. So we can use it, or I've said this before, we use it. It's a dry system. We don't have liquid on the floor. We work with people with fall risks all the time. You become very aware of potential fall risks, particularly depending on the area of your care that you go into. All of these things are important that are there. Okay. And yes, there's some limitations with it. And we utilize alcohol sometimes it enhances the availability of certain agents when we dissolve them in alcohol. That's a whole other sub-lecture. But it is not a disinfectant, not under any way, shape, or form. Okay? It's just not that strong. I mean, it's not going to do anything on a tabletop in the lab or on a tabletop in your home to speak of. If that's all you have, then you use it. Aldehydes, big players. And this is part of today's discussion, has to do with preservatives. Okay? Aldehydes, and the most famous of these is certainly formaldehyde. Formaldehyde is still utilized when we're in the operating room, we take a specimen out and say, I'd like to send this to pathology because I want to find out what's going on. Okay? And you collect those specimens in the operating room, whether it's a piece of bone, piece of tissue, a piece of whatever, potentially a piece of tumor that's there. We put them in a little sterile container that's got liquid in it. The liquid is formaldehyde. It's a preservative. I utilize glutaraldehyde because it is a sterilant. Okay, it came in a concentrated form. We diluted it. We changed the solutions out every day, and so this is what was used. Been around for a long period of time in my office. But those were for medical instruments that we immersed. And then in between times, we just disinfected them in the same solution. You had to wipe them off immediately before contacting a patient's skin with them because the residue is relatively corrosive. So you really had to rinse them. So we'd have alcohol, we'd rinse them off with, with sterile water or sterile saline. This has been a little bit more commonly used, but you can see there's problems associated with it. This was the classic agent, okay? Formalin, 37% solution. Very effective, inactivate viruses for vaccines. Aha! Probable carcinogen. So part of today's discussion has to do with the problem with vaccines. In extensive full disclosure, I am not a vaccinate everybody advocate. I think we vaccinate more than we need to. This is not a recommendation. I'm not anti-vax. You've got to get your kids and you yourselves, just like my kids were, my grandkids, now my great-grandson, they're all going to get the appropriate vaccines. There is no reason in pharmaceutical science that we can't make a safe vaccine. The problem is preservatives. Period. End of sentence. For years, they used formaldehyde. I don't know if that troubles you. It troubles me. They're going to say it's a very low risk. And you're going to see there's a lot of studies that prove there's never been a link between this and that, particularly when we get to the autism part of the program. It's there. Okay. I'll buy that. There's never been none of the studies have disproved that there's a link. Okay. There's never been a link shown conclusively, statistically. There's never been any degree of research to disprove it. See, a lot of times it's called the null hypothesis. Maybe you heard about it in school. So if there's other ways to prove or disprove things. Not getting into that. It's not part of the discussion. It's not like Dr. Stein hates vaccines. Okay. Again, sense of full disclosure, I did not have the COVID vaccine. Any of them. If anybody was at risk, it's probably one of the older. I got to figure I'm the oldest one who's teaching you these days. When they roll out something really fast, you got to be a little bit questionable about it. Okay, moving on. So the whole idea of this particular presentation is to make you understand that there's pharmaceutical companies certainly, to a certain extent, have your best interest in heart. Understand, companies are companies. Their best interests are their stockholders. It's about the money. So this was an inexpensive way, and we have to find a way, but it costs money to find new ways to make things that don't have a downside. So they don't use formaldehyde anymore. They use other agents that are there. And most of these agents don't make a darn bit of difference to you and I once you reach a certain age. My concern is using it on the problem with these toxins is when particularly we get to the one that is the most controversial, which is mercury. A product called thimerosal. They are neurotoxins, and they're using on children whose nervous systems are not fully developed. You're going to have to do what you feel is right. And maybe as time moves on, by the time you're in the field, many of you, and you have children of your own, you'll be able to. There's a lot of pediatricians, a lot of healthcare providers will use vaccines judiciously to make sure, and they'll use ones that are safe. Maybe they'll cost a little bit more. Vaccines are a big problem because if you did not know it, one of the legislations that occurred during the Reagan administration is the worst one. They have indemnified pharmaceutical companies from being sued for bad vaccines. Word indemnify means you cannot sue them. They have a vaccine. You can't. They don't have any legal. They do is make money. So understand that you're putting your trust in somebody, and hopefully they benefit by it. But they cannot be. They're not subject to any legal ramifications. You are professionally. I was professionally. They are not. So you have to rely that they have internally, they are aware of it, and they're working to your best effort. I hope that continues to be true. I do not know. So that's the business with aldehydes. They're toxic. We use them as sterilants. They're still used today. I think they're a poor choice to use for vaccines. I mean, if it says a carcinogen, probable, why take any chances with somebody's baby? Biguanides, a wonderful category. Chlorhexidine and chlorhexidine agents have certainly been the poster child for very, very successful. You use them all the time. They're in mouthwashes. If you had your wisdom teeth removed and they gave you something to gargle with, or as a mouthwash, that was chlorhexidine. That's the soap of choice that you will see for scrubbing. It's enhanced with soap. It's one of those neat things. Iodine, certain kinds of iodines are enhanced with soap as well. We're going to get to those shortly. It's interesting. You can tell the difference between that and what we call an iodophore or iodine-based soap used for surgical scrubbing. The chlorhexidine-based soaps or biguanide soaps, the soap has like the pigment is sort of white. It comes out red, the soap, so it's like white or pink when you're doing surgical scrubbing, where iodine-based soaps are brownish in color. That's a distinctive difference. They're typically both available for surgical scrubbing. You're going to see chlorhexidine soaps all over, typically in the hospital. UPMC switched them. If they switched them, everybody else switches them. Okay, because they have a residue, but it's useful. Very low toxicity. I mean, it's not going to sterilize anything. It's purely an antiseptic, but extraordinarily valuable. Catheters have it on them. I mean, this is stuff you're going to become very familiar with. So the category is biguanides. Anything you open sterile, whether it's a Band-Aid, I'm not talking about surgical blades, whether it's a Band-Aid, whether it's a Q-tip, whether it is a pack of 4x4s that you get from Johnson & Johnson out or whoever you're going to get generic ones. Doesn't matter. Okay, a needle, a syringe, poison gas. Put in a big room like this, effectively a gas chamber, okay, extraordinarily destructive, takes time, okay, all those things. The dishes you're using, the pipettes if they're sterile that you're using, the ones you have in the big box that are there in the micro lab that are they're by no means sterile. You can still use them depending on the laboratory that you're using. So it's called a gas clave. Now they use rooms that are much larger that are there. All of those things are bad. We used to be able to get those. I had a choice between getting an autoclave and a gas clave. So you could, before they realized all this stuff, explosive, toxic, and potentially carcinogenic, then you couldn't buy them for a doctor's office. 50 years ago, when I started in practice, you could buy one. Okay? And so as you can see, this is the problem. Now, as we begin to understand the environmental impact and the risk, then now only very large companies can use them. So they're all gas sterilized. The gas is not there. There's nothing to be scared, to frightened about it. But this is a major way for paper disposables, disposable syringes and needles. Okay, years ago, they used to re-sterilize and reutilize those things. That was inherently problematic, particularly when we start getting to the viral transmission and things along those lines. So it's really unique. The most common category that we use household-wise and we use hospital-wise are halogens. Halogens are up there on the periodic table. Bromine, chlorine, fluoride, iodine, they're all there. We fluoridate our water, okay, to prevent cavities. We use bromides, and sometimes those are agents that you can use in hot tubs and things like that. I personally prefer the chloride. Like we have a tiny hot tub sitting there on the deck or inside the deck. Yeah, every other day, maybe we take, half a cup full of bleach, run it, let it run through, works fine. Okay. Extraordinarily effective. It is a disinfectant. It is not an antiseptic in any shape or form because it is caustic to the skin and mucous membranes. You dilute this. Typically, I would take an ounce or two and with a gallon of water, and it is just fine. Gallon of water is 128 ounces. I'd take an ounce or two. I'd make it more than a 1 to 100, maybe a 2 to 100, or a 1 to 50 dilution. Very low levels disinfect drinking water. That's why I use it in water treatment. But you have to do something to get rid of that kind of funny or funky taste. Okay, it doesn't mean it's unsafe because it tastes lousy. It just tastes lousy. I mean, so we have a Brita filter at home. The water can be really unpleasant that are there. But as you can see, there are certain things, so you have to use a multiple group of methods, whether it's ultraviolet light, whether it's filters. I mean, there's a lot of different ways. Water treatment is really something. It the problem is the reaction with the organic compounds can play a role with regard to it. So that's why there's a lot of filtration and things like that are involved with water. Water's filled with sewage. Okay. The most famous river that goes through Washington, D.C. right now is filled with sewage, the Potomac. It's a cesspool. I can't figure out why that's going on here. Our rivers are bad too, but I grew up in the land where the rivers were the worst. And that's in northern New Jersey with tons and tons of chemical plants. We had rivers that were awful, awful. Talk about walking on water. You could walk in those rivers. So all of this is somewhat useful. There are various kinds of, these are more gaseous-based ones that are there, but it's perfectly effective. Limitation, it loses its potency after 24 hours. They need to be changed out. The fact that they're not doing it in the lab doesn't matter. We're not dealing with anything so harsh. You're basically want to just disinfect those tabletops satisfactorily. That's fine. Okay. That is really, so that's a halogen. The halogen that is used as an antiseptic is iodine. Okay. Iodine, vegetative cells, unreliable on endosperms, not a steroid. For years, it was used as a tincture. They mixed iodine and alcohol together. It was in a little bottle in everybody's medicine chest when I was a kid called tincture of iodine. It had skull and crossbones on it. Okay. And your mom used to chase you around when you cut your knee to put that on you because it stung like anything. Iodine was released very quickly in this combination and it hurt like anything. I don't care. I don't want the iodine. They did the same thing with tincture of mercury called merthiolate, tincture of merthiolate. Stung like anything. What happened was they basically took iodine and they bonded it to a protein carrier, okay, called an iodophore. I only had my. So they made a combination of iodophore plus iodine that they used to just have in the tincture together, and magically it slowed the release. The name, famous name that we still use extensively, betadine. So betadine solution is this. Also, when you mix it with soap, it's even better for surgical scrubbing. So just like chlorhexidine, these are the two agents. They are antiseptics. So the carrier molecule of the iodophore was magic. Notice, it's not a panacea. It is useful. It's not going to hard to get rid of items. If you notice in the lab, when you're doing gram stains, and you get the crystal violet, and you get the grams iodine, and you get all those other agents, you see little crystallization. Sometimes little crystals that are in there in the little vials. Yes. You know stuff around the edges. You ever see crystals on your stains? You will. That's the problem. Okay. Once it begins to come out of, once you get crystallization and it's not as uniformly distributed as it needs to be, we begin to see things that can survive in that solution. If you did not know it, things like that, like the crystal violet or gentian violet, it was called gentian violet, that you used, okay, when you did the lab and things like that, the carpet, you do the endospore stain, and did you do the acid fast stain? Carbofuchsin used to be called Castellani's paint. Those agents were used, and we put them on skin. They painted them on skin. They were very effective against bacteria, particularly gram-positive. Before we knew a whole lot better, so they were used topically in a lot of areas when you couldn't put a Band-Aid on. That gentian or crystal violet, you have, when we put stitches in lips, you put something on them. They came out with purple lips. When we had damage in the anogenital area, that's where it was used as well. Just give you an idea. So, I mean, there's nothing new under the sun here. So, I mean, I've had the experience of using all of those things working in an emergency room 50 years ago. So, this has been a big advantage. This is why it's so useful today, but it is an antiseptic. It is not a panacea. In other words, it's not magic. There's no magic product out there, believe me. Metals. This is the other part of the vaccine discussion. Okay? What they do, metals denature proteins. They combine with what are called sulfhydryl groups. Nasty. Very, very toxic. Okay? For years, and they still use metals. If you have cavities in your mouth, okay, for years they used metals. They used to put silver and gold in there because of bacteria. Very expensive. Then they used cavities, and they filled cavities with crowns before we had all the cosmetic stuff that was there with what we call non-precious metal alloys. I don't know what they did. They're going to take whatever steps they are doing. There's something in there that is useful, and whether it is metallic in nature with just some type of cosmetic coat to make it look more like a tooth rather like a mouthful of stuff. Silver is used extensively. There's an old saying in science and in medicine, particularly in medicine. If there's one best product everybody uses, that, ladies and gentlemen, is called Silvadene cream. It is the best thing for topical application for burns. Nothing has even come close. It's been around forever. We used betadine ointment. It wasn't as good. It's a combination of silver salts and a sulfa agent. Together, it's magic. Silver is the magic. Everybody uses it. It's like slam dunk. So it is a significant player. Silvadene cream is great topically. Okay. Years ago, we used to put, now we use topical antibiotics when babies were born, before we had enough, before prenatal care was emphasized and made readily available. A lot of people, unfortunately, a lot of babies went blind because of diseases that were not being checked in the birth canal during vaginal birth. We'll go into that when we look at genital urinary diseases. At that point in time, what they did is they took something called silver nitrate. When you were in the chemistry lab in high school, they used to do an experiment with that. Trouble is, if you got silver nitrate liquid on your fingers, they turn black. Nothing serious about it. It just turned black, and it would go away over time. The trouble is, we used to put drops in babies' eyes, and they come out with black eyes, and it drove moms and dads crazy. Oh my God, you beat up my little baby. So for that reason, we use topical antibiotics now. It was all about gonorrhea, which was rampant, much less rampant, but considerably still present today. So these were used as preservatives. They are strictly regulated. The one that is the most controversial and the whole vaccine, anti-vax wave. I'm not in agreement. I'm for vaccines are made properly and not essential. Because there's inherently a risk with administering vaccines. They're not, it's not innocent. Why don't we have one for the common cold? Colds aren't for the cold. This was the age. I remember 25 years ago or so in England, some terrible research done that tried to link, and really was faulty, as a positive link with autism. There's a lot of reasons why we see an increase in autism. It's diagnosed more. So there's a broader criteria for diagnosis. We are certainly seeing an increase in the diagnosis that's there. Could it be involved with environmental pollutants? Absolutely. It's overdiagnosed. There's like epidemic ADD and ADHD in my kids. Kid, bouncing around, particularly as a boy. Oh, hyperactivities. Come on. My eldest likely going to be an addict for about 5 years. let's be clear, it's overdiagnosed. Those types of things. And people went nuts because thimerosal was a common preservative in vaccines, and it still is. So the next time for many of you, when you start to get clinicals and things like that, look at the thing with the vaccine. You'll see thimerosal. And what happened afterwards, the British Medical Journal that published this retracted it because the research was faulty, but it didn't stop. And by that time, all of a sudden, the wheels were rolling and people were all over it. It's always a great time to teach this particular unit during Lent. Because, I mean, you're going to get more mercury when you go to fish fry. Okay, on Friday nights, wherever they're offered. It's in fish all the time. There's plenty of mercury that's in there. But our nervous systems have evolved. Our nervous systems are fully developed. It can't really harm them. But, you know, a baby under a year, and they start giving vaccines, you'll see the vaccine schedules. Okay, that's the question. And it's the same recommendation I gave to my daughter, I gave to my granddaughter. Wherever you go, ask them for thimerosal vaccine, thimerosal-free vaccines. If they don't say, well, it's never been proven, say to them, yeah, it's never been disproven. I'll find it. There's a lot of doctors out there. They all want your business. They get paid. Maybe 50 years ago, being a doctor was the way to make a lot of money. I didn't either. Do it. Most likely, if I did it, other than to annoy you, I would be here specifically to annoy you. Sorry, I like Karen. Most of you I just want to annoy for fun. But the reality is, and I know I'm very preachy about this, but today's the preachy day. Okay? I think you have to be wary about this. It's up to you. Okay, because so many of the students who come in here want to go into pediatric nursing, pediatric ICU, and all that type of stuff. I understand that. It's a wonderful avocation. You do a tremendous amount of good. That's why there's always going to be controversy. Right now, we have politicized vaccines. We've gone from now we're back at the anti-vax because of the administration it's in versus pro-vax. Previously, it drives you crazy. Medicine should never be politicized. We should do good research and make healthy vaccines and tell the pharmaceutical companies, hey, you know, if you mess up, there's going to be consequences. That's my 2 cents. So much for the sermon on that. So metals have their role. They've been around for a long time. Very, very much so. I don't know enough about ozone. Again, we're using it a lot for wastewater and for drinking water. It's something that there's an explosive quality, so it has to be used. I won't ask you about it, but it's there. Maybe one of the best agents, peroxygens, that's peroxide. They are interesting because they're biodegradable. One of the first health clubs I went to, one of the first gyms I went to, they're disinfecting, and most of them use they're going to see the quaternary ammonium salts because they don't have an odor. They don't have an odor. They used peroxide with orange oil. Okay, orange oil is a very effective agent. It's used in a lot of detergents that are there, and they mixed it with peroxide, and it was used very effectively. That particular club had a silver sneakers program, so a lot of the people who went to that particular gym were over 65. So they had a really good deal, or if they were retirees and had UPMC insurance, they would pay for their gym membership. So biodegradable, doesn't leave a residue, much less toxic than these other things. Very effective. Again, it's all about this. Our cells Okay, produce catalase. It breaks it down rapidly to oxygen, gas, and water. Okay, it's even so we can, and both betadine, I should have mentioned it to you, and peroxide, full strength, are not useful on healing wounds. On acute wounds, they're useful. But if you have a long-term wound care, we always diluted them by 1 to 10. There are tons of studies about that. If you're learning about dressings and you're talking about wet to dry dressings and betadine dressings and peroxide in wounds, please, whatever your nursing instructors tell you to use, use. Do not tell them Dr. Stein said that's tissue toxic, even though it's it. You'll know and I'll know. But they're going to do it their way. But if you've worked in a wound care clinic, and I have a tremendous background in wound care, in the early days of wound care, before it became very, very sophisticated, there's a tremendous amount of science about this stuff. My first wife got certified in wound care and was a wound care nurse for a fairly large nursing home. Just to give you some ideas about this. That's long-term, that's chronic care, that's elderly people, that's a whole different subset. Some people love it, some don't. It's an area I was very fond of working with. There's even more potent forms as a sterilizer. Vapor phase is what's used to clear out, to sterilize the internal aspects of juice boxes and those little pop-off containers that we can keep things shelf-stable for long periods of time. So it's very, very effective. You're going to use good old 3% peroxide, which you get when you go over to Giant Eagle, you go to one of the pharmacies and pick it up, that you might use at home for anything. Use it all the time ourselves that are there. And the reason it bubbles is cells are exposed. Aerobic cells, like our cells, have catalase and superoxide dismutase. You remember that? You should. And the catalase exposed, and that's why it bubbles. So we use it a lot. Historically, this was Lister. We don't use them as much anymore. If you bought antibiotic soap 10 years ago, I think it was 2017 they took it out. So if you bought it 10, certainly 15 years ago, every antibacterial, not antibiotic, every antibacterial soap contained triclosan. It was a phenol derivative. Before that, we had another one called hexachlorophene. They are now severely restricted. Hexachlorophene was a neurotoxin. Triclosan started to accumulate in organs over years, and they basically replaced it with what you're going to see are quaternary ammonium salts. Are they effective? Yes. Full strength, you cauterize with them. I used to cauterize warts with them. I take out a wart and I cauterize the surface to destroy all the viruses. Very unpleasant, nasty stuff. It burns like crazy. It's called carbolic. There should be an L there. Carbolic acid. It's actually the base part of it is the nasty part, without getting into the chemistry of it. Not reliable on all viruses, but that's what Lister diluted it until he came to a solution that worked on skin, on instruments, on materials, hand washing, all of those things. And yes, there was a residue, and yes, it worked pretty well with organic contaminants and things like that. But now we are restricting its usage. So you see, and I think it's more historical. Originally, it was in mouthwash. Listerine had this phenolic. It had a very distinctive taste. What we use more so now than anything else are these quaternary ammonium salts. When we're looking for something in the food industry, when you're wiping down tables in the restaurant, if you've been sitting there, quaternary ammonium salts, Lysol wipes, Clorox wipes, because it doesn't have an unpleasant smell or taste. Is it very effective? Very low level of toxicity. Okay, does it disinfect food preparation surfaces? Somewhat, but very, very low level. Okay. So it aids is a good way to describe it, and all of those things. The positive charge quats attracted to the negative charge of the cell surface. That whole thing about new staining sequences and things like that. Okay, lots of personal care products, still things growing it. You're getting a seed that's Pseudomonas is a pain in the neck. Did you get work with Pseudomonas in lab yet? Did you get cultures of it? Oh, it's coming. You start to do gram-negative enterics everywhere. So here's the chart. And you can look at it and summarize a lot of these things. I think it's really important. We're not done completely, but we're basically done with this chapter. If you look at things that you purchase, you're going to see all those things say benzoate, sorbate, all of those things. ATE, when you put an acid in water, we get ATE. Okay? Because what happens, it ionizes in water, and the acid component, rather than being benzoic acid, is now benzoate or sorbate or propionate. Okay? So they are basically food preservatives. The less of those, the better that you have. You're going to find them a lot in certain foods that are there. Be careful with them. Same thing with nitrates and nitrates, okay? Because of endospore formation, stopping botulism. So they maintain sort of a pink color, which we use them in food, cooking. When you'll see, we use potassium nitrate, which is called pinking salt, because it's a salt, potassium and nitrate, but it gives that nice pink color to things like corned beef and pastrami if you make them yourselves. They're there. So when you're the corning process, which is really a form of preservation that goes on. And you can see what the problem is. They were in hot dogs all the time. Now they typically are not. So you've got to be very, very, very watchful with this. And again, refrigeration slows down the growth. Okay. So all those organisms can still grow. The microbial cell is killed by ice crystal formation, but many survive and can grow once thawed. Crystals play a role. Like I said, there's a whole unique way of dealing when you are freezing things and being careful and putting, because you want to resist this as much as possible. So people have to understand what they do when they freeze things. I think you continue to have to be careful and don't do. We all do it. I'm guilty of it. I've been teaching this for 25 years. I still don't label my thing with the date and the label on it. If you would do that, then you wouldn't sit there going into the freezer, and we have a giant deep freeze at home. I have no idea what's on the bottom, how long it's been there. We've had the freezer for about 10 years. Heaven only knows. Don't look at me like that. Somebody, your mom or you or your dad, have gone into your freezer and gone, what is this? You know who you are. We're like this. My wife periodically wants to clean up. And so, and we're just about done. So, and this is what salting and sugar or drying do. You're sucking out the water. Remember, it's going to break the cells apart. Staph can survive. Freeze drying is a little bit better. I've never got dried eggs, so I'm inclined to stay away from them. And that concludes the presentation. So again, I should have the grades posted.